Do you feel a sharp catch of pain in your lower back every time you stand for too long or bend backwards? Most people blame muscle strain and move on. But what if the bone in your spine has actually shifted out of the place and every day you ignore it, it's slowly slipping further? Hi, I'm Dr. Jayesh Bhanushali, a spine specialist, and I've helped thousands of patients stabilize their spine and get back to living pain-free. By the end of this video, you'll know exactly what a slipped vertebra is, how we know how serious yours is, and what treatment each condition actually needs. So you stop guessing and start getting the right help. The medical name for this condition is spondylolisthesis. It sounds complicated, but it simply means one bone in your spine has slipped forward over the bone below it. Most patients call it a slipped vertebra. Look at this MRI. See how your spine bones are stacked perfectly on top of each other. Now see this bone here. Instead of sitting perfectly aligned, it has shifted forwards over the bone below it. That shift, even a small one, changes everything. Because right behind those bones runs your spinal canal and that tunnel carrying all your nerves inside. When a bone slips forward, it narrows that tunnel and starts squeezing the nerves inside. This is why you feel pain in your lower back. That is why the pain sometimes shoots in your legs too. And that is why bending backwards or standing too long makes it worse. Because those positions push the slipped bone even further into the nerve space. Now, why does this happen? For older adults, the joints and ligaments that hold the block together simply get loose over a period of time. For youngsters and athletes, it usually caused by a tiny stress fracture when they bend forwards too much. In some people, genetics simply makes these joints weaker from birth. The most important thing to understand is this: it doesn't happen overnight. It's a slow, gradual shift, which is exactly why catching it early makes such a big difference. So how serious is your slip and what do you do? Not every slipped vertebra is the same. Some are mild, some are serious. And the treatment depends entirely on how far that bone has shifted. Here is how we think about it in simple terms. If the slip is small, you'll have occasional back pain that comes and goes. The good news is surgery is almost never needed at this stage. Targeted physio, core strengthening exercises are usually enough to stabilize the spine and stop it from slipping any further. If the slip is moderate, the pain becomes more persistent. You'll notice tightness in your legs, discomfort when you stand too long or bending backwards. We still try non-surgical treatment first: physio, injections, some lifestyle changes. Most patients at this stage get better without any surgery. If the slip is severe, the bone has shifted far enough that it now seriously squeezes the nerve. Pain shoots into the legs, walking becomes difficult, and daily life is affected. At this point, surgery becomes necessary to stop the bone from slipping any further and take the pressure off the nerve permanently. The earlier you catch it, the more options you have. A small slip caught early can be managed completely without surgery. A slip that has been ignored for years may leave surgery as the only option. This is exactly why an X-ray and proper clinical assessment matters, so we know exactly where your slip stands and start the right treatment before it gets worse. The most common thing I hear in my clinic is, "Doc, if my bone has slipped, can't you just crack it back into its place? Or can a chiropractor push it back?" No, a slipped vertebra is a structural shift in your spine. It cannot be cracked, massaged, or pushed back into its place. Attempting to do so can actually make the slip worse and cause serious nerve damage. This condition needs proper clinical assessment, not a quick fix. So remember, a slipped vertebra means one spinal bone has shifted forward over the one below it. A small slip can be managed with physio and the right exercises. A moderate slip still has non-surgical options. A severe slip needs a surgery to protect your nerves from permanent damage. The most important thing is that you don't wait to find out how serious yours is, because a small slip that is actually early and very manageable problem. Same slip ignored for 2 more years may become a surgery you could have avoided at that point in time. If you have back pain that is getting worse when you stand too long or bend backwards, get an x-ray done. Ask your doctor specifically, is there any slippage in my spine? And that one question could change everything. Share this video with someone who has been told they have a slipped vertebra and has no idea what that means or how serious it is. This video could help them get the right treatment before it gets worse.